Madam Clerk, please call the roll.
Representatives Baum, Camper, Freeman, Gant, Hawk, Hazelwood, Lynn, Ogles, Todd, Whitson, Williams, Wendell, Chairman Hicks.
Here.
You have a quorum.
Thank you very much. I'd like to call the Finance, Ways, and Means Subcommittee to order for April the 19th, 2022. Members, any announcements or personal orders before we begin? Seeing none, we have various calendars before us today, but for the purposes of this meeting, and I want to make sure everyone is clear, for the purposes of this committee, we will only be taking up calendar one. So if you do not have a bill on calendar one, it will be taken up, and you're on the other calendars, you'll actually be taken up probably around 2:30. And of course, if you haven't already noticed, time is very fluid today. So, but we will be taking up those bills. So let me just go back. So we'll have right now subcommittee. Of course, we're beginning now. We'll take up the bills on calendar one. Once we finish up, we will actually adjourn, and then we will come back as far as budget sub is concerned around 2:30. Full will actually meet at 1 o'clock. So that's the tentative schedule. And again, those times could be a little bit fluid. So just bear with us as we work through this. All right. So we will actually recess at the end of this committee. Sorry, I misspoke there and said adjourn. All right, let's get started. Members, we're going to begin with item number one. Item number one on our calendar is going to be House Bill 2040 by Chairman Whitson. You have a motion to second. Sir, you are recognized.
Thank you, Mr. Chairman. Committee, House Bill 2040, as amended, creates standards for electronic monitoring companies operating in the state of Tennessee. With that, Mr. Chairman, I renew my motion.
All right. Thank you, Chairman Whitson, for this description. Members, you heard the description. Any discussion on House Bill 2040? Seeing none, House Bill 2040 does have a cost associated with it, so we will have to place it behind the budget and consider it at a later date. Any objection? Seeing none, behind the budget. All right. That brings us to item number two on our calendar. Item number two is going to be House Bill 637 by Chairman Howell. There's Chairman Howell. You have a motion and a second. And it looks like you have an amendment that has been filed, drafting code 011214. Is that correct?
That's what I have, Mr. Chairman.
All right. You have a motion and a second. Looks like this actually rewrites the bill. So let's go ahead and get this put on in the proper posture. You have a motion and a second. Any discussion on the amendment? Seeing none, we're now voting on the amendment 011214 on to House Bill 637. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended. You're recognized, sir, for a brief description.
Thank you, Mr. Chairman and committee. I think we've tried our best to talk to most everyone on this committee about the situation. This bill addresses an unfair sales tax situation that currently exists with respect to the application of what's called the repossession credit that is found in TCA section 67-6-507D. This section in the code allows a repossession credit for sales taxes that are unpaid by a customer who purchases tangible property such as a vehicle. And if that customer fails to pay the tax, then the dealer can take a tax credit. This is, again, affecting a small number of used car dealers as described in this bill. And the genesis of this bill came to me from a company in Bradley County whose owner is a constituent of mine. And they adopted a business model unlike most used car dealers. The average used car dealer in Tennessee will require about a 15 to 20% down payment of a used car. And then on top of that, the full amount of the sales tax has to be paid, I believe, within 30 days to the state of Tennessee. That's a pretty high hurdle for most low-income, low-middle-income consumers who are looking for reliable transportation to get them to and from work, to and from church, to and from schools. And as a result, the genesis of this bill, the company and other companies, small number of companies in Tennessee that use another business model, Their model requires only a 5% down payment. And the company then, out of its own pocket, pays the sales tax upfront within 30 days to the state of Tennessee. Then they set up monthly payments, and within that payment, the customer pays back the sales tax that was previously paid by the dealer. This worked well for a number of years. This company, this family that I know personally, they've been in the car business for about 4 decades. And they adopted this model for their used car business. And back in '09, it went through a Department of Revenue audit. There were no findings on that audit. Another auditor comes along, a new and different auditor from the Department of Revenue, or he may have been a contract auditor, I'm not sure, looked at the situation in 2015 and said, no, you do not qualify for this tax credit, and required them to pay a $2 million reimbursement and requires them to pay, since 2015 until now, about $500,000 a year in additional taxes that they were not required to pay previously. And this has amounted to a total of about $5 million since 2009. We believe the code says that they do qualify for this because there are other companies with a similar business model that are allowed to take the tax credit. The only difference is these other companies pass the note off to a finance company, and they again are allowed to take the tax credit. This company, the focus of this bill and companies like it, keeps the note in-house. They pass the note off to an in-house finance company located in the same building. They're doing exactly the same thing.
Gotcha.
But the auditor says you don't qualify for the tax credit. And I might add, if a car is leased, the sales tax can be paid monthly. And that's what the dealer is doing. He's allowing the sales tax to be paid monthly back to him since he's already paid all of the sales tax up front. I believe this is unjust. It's a financial windfall for the state of Tennessee, and I believe it should be addressed. Senator Bell and I have worked closely with the Department of Revenue to try to resolve this issue. We believe the company was qualified, according to the code, to take this tax credit in the past. We believe that it is currently qualified to take this tax credit. It has passed the Senate Revenue Subcommittee with a positive recommendation, and I understand it's on the Senate floor today. The Commissioner of Revenue, as well as his staff, have been extremely open and cooperative in our discussions about this issue. And I might add, they do not deny that we have a very good argument to make our case. Unfortunately, the audit ruling has not been changed, and we have been unable to reach an agreement. The bill simply makes it clear that if you sell a used car and gets approval from the Commissioner of Revenue that you meet all the requirements outlined, the primary one being that you require a down payment of 5% or less, that you are authorized to take that tax credit on your business. This company and other companies like it in Tennessee are being penalized for trying to help people to get into a good used car at a reasonable down payment price and paying the sales tax for them up front, and they pay it back monthly. It's generating a windfall for the state. It's just wrong, and I would appreciate the committee's approval of this bill.
All right. Thank you, Chairman Howe, for this description. Members, you've heard from the sponsor. Any discussion on House Bill 637? Representative Hall.
Thank you, Mr. Chairman. And to my seatmate, Chairman Howell, thank you very much. I know you're doing this work for your constituency. I appreciate that. There's always a fear that tax policy could put someone out of business. And I know you mentioned these folks have been in business for 4 decades. Is there frustration or potential frustration where this business says, we're done, just going to throw up our hands and we're going to quit fighting the quit fighting the system and retire and go to the House. Is that a possibility, Chairman?
Chairman Howe.
Well, I can't speak for the constituent. I can tell you this, the owner of the business, I've known him for years. He's been an outstanding local citizen. He is past retirement age, and that could be a distinct possibility. And I might add to the committee, this is not unlike the same situation we saw a couple of years ago with the Jack Daniels audit situation.
All right, thank you, Representative Hawk. Okay. All right, further discussion on House Bill 637. Seeing none, House Bill 637 does have a cost associated with it, so we will have to place it behind the budget and consider it at a later date. So without objection, House Bill 637 is behind the budget. Thank you. All right, members, that brings us to item number 3. Item number 3 on our calendar is going to be House Bill 2762 by Chairman Doggett. You have a motion and a second. You are recognized on House Bill 2762. It looks like you've got an amendment drafting code 017658. Is that correct?
Yes, sir, it is.
You have a motion and a second. You're recognized on the amendment.
Thank you very much, Mr. Chairman, committee. What we did is we took a couple things out of a previous amendment to get the fiscal note back down to not significant.
All right. Thank you very much. Members, you've heard the description of, again, drafting code 017658. Any discussion on the amendment? Seeing none, we're now voting on the amendment to House Bill 2762. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended. You're recognized on the bill as amended.
Thank you, Mr. Chairman. For the next 20 minutes, I'm going to try to explain this as thoroughly as possible. But if you would like the condensed version, I can offer that as well.
We would prefer.
So thank you. What we're doing is codifying right now the current pay scale that the Public Defenders Conference and the District Attorney General's Conference are doing as of today. We're just putting that in code.
All right. Thank you very much, Chairman Doggett. Members, you've heard the description. Any discussion on House Bill 2762? Seeing none, we're now voting on House Bill 2762, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 2762 moves to full finance.
Thank you very much.
All right, that brings us to item number 4 on our calendar. Item number 4 is going to be House Bill 2850 by Chairman Kumar. You have a motion and a second. You are recognized for a brief description.
Thank you, Mr. Chairman and committee. House Bill 2850 does have an amendment 016838.
Yes,
I don't
sir.
know if it's traveling.
It's
with it.
traveling.
Thank you. Members and friends, since passage of constitutional carry, we do not require people to take a gun safety course. Let's face it, a lot of people would benefit from it, and they do really need it. This bill incentivizes people to take this course in the form of payment from the state of Tennessee towards the gun safety course. The administration has authorized the Department of Safety to pull $1 million out of the handgun carry permit reserve fund, which is substantially large, and to contribute towards this. And of course, on a year-by-year basis, renewal of this is contingent upon funding from that handgun carry permit reserve. And it says subject to appropriation. So for the first year, we are good and funded. And subsequently, we will see how the program performs. Thank you, Mr. Chairman.
All right. Thank you, Chairman Kumar. Members, you've heard the description of House Bill 2850. Any discussion on House Bill 2850? Seeing none, there is a cost associated with House Bill 2850, so we will have to place it behind the budget and reconsider it at a later date. So without objection, House Bill 2850 goes behind the budget. Thank you,
Thank
Chairman.
you.
All right, members. Thank you for your patience. All right, that brings us to item number 5. Item number 5 is going to be House Bill 2143. We're going to roll this to the Hill. So without objection, House Bill 2143 roll to the Hill. Brings us to item number 6 on our calendar. Item number 6 is going to be House Bill 2545 by Representative Alexander. You have a motion and a second. You are recognized on House Bill 2545 for a brief description.
Thank you, Chairman. Thank you, Committee. House Bill 2545 is amended. There is an amendment on it.
It's traveling.
Pardon?
It's traveling. You're
so
ready to
we're
go.
okay. All right, good. This amendment basically allows CNAs, this bill as amended allows CNAs to also become medical aid assistants, which allows them to disperse medication. Once it was amended, it took the fiscal note off. So it's basically what it does.
All right. Thank you very much, members. You've heard the description on House Bill 2545. Any discussion? Seeing none, we're now voting on House Bill 2545, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 2545 moves to full finance. Thank you.
Thank you, Committee.
All right, that brings us to item number 7. Item number 7 on our calendars, House Bill 2283 by Representative Beck.
Thank you, Mr. Chairman. I have an amendment.
Yes, sir. And that drafting code, you have a motion to second. That drafting code is 017523. Is that correct?
That's correct.
All right, you have a motion to second. Since this does rewrite the bill, let's go ahead and get this put onto the bill, and then we'll recognize you to explain your bill as amended. So,
Thank you, sir.
members, any discussion on the amendment? Seeing none, we're now voting on drafting code 017523 onto House Bill 2283. All those in favor say aye. All those opposed, no. The ayes have it. We are back on the bill as amended, and you are recognized.
Thank you, Mr. Chairman. Last August, security cameras showed a group of men holding down a 22-year-old Dallas Barrett during an altercation on Broadway at Whiskey Row Bar. He became unresponsive and later died. The grand jury has indicted 6 people for reckless homicide. 6 of the employees working as security guards were unlicensed. This bill is in response to that. We're bringing these security guards under what they call PSO, propriety security organizations, where you can go and each organization or each establishment can have its own security force. This will allow for training of not only to help in safe takedown techniques, but also how to de-escalate certain situations. And with that explanation, Mr. Chairman, I'm prepared to take questions.
All right, thank you, Representative Beck. Members, you've heard the description and discussion on House Bill 2283. Representative Lynn.
Thank you, Mr. Chairman. Does this mean that no one would be able to work security unless they were licensed from now on? Like you were saying that these folks were working security at a bar. I guess they were bouncers or something like that.
That's correct.
Does that mean that no one at all would be able to work security, say as a bouncer or something, unless they were licensed or working for a licensed security agency?
You're recognized.
This bill only pertains if you've got a license from the ABC or a beer board. So it's not going to apply to organizations such as, a dock worker at a Walmart. This only applies to if you do have a license with the ABC or the local beer board.
Representative Lynn.
Okay, so the answer is yes. If it would, in that situation, you've got a license from the ABC, the beer board, you cannot hire any security like a bouncer unless they have a license or they're working for a licensed security company.
Representative Beck.
You either have to work for a licensed security company or you have to work under one of these PSOs, proprietary security organizations, which any organization or any establishment can create their own PSO, but it's done from establishment to establishment. And yes, they would have to be licensed.
Representative Lynn.
How much does this stand to raise the costs for proprietors of businesses that have a beer board license or a liquor license, how much does this stand to raise their cost of operation? And, we had a voluntary program where convenience stores could send their folks for training, and if they sent their folks for training on, underage drinking, that would get them certain credits. Might it not be better to do something where they're encouraged to send their bouncers or whatever for training, rather than us forcing them to buy their labor from some other organization? Because it sounds like they're going to have to buy their labor. Bouncer doesn't really work for them anymore. The bouncer would have to work for a security company or a PSO. Might it, well, just answer those questions.
Representative Beck.
They have to be, Representative Lynn, they have to be licensed already. All this bill does is gives them, when they renew their license every 2 years, that they'll have to have 2 hours of a refresher educational course. So it's not changing any form of where they get their security.
Representative Lynn. All right, Representative Todd.
Thank you, Mr. Chairman. And to the sponsor, is a business that employs someone in this type of role already, or any of their employees, aren't they already liable for what those employees do?
Representative Beck.
They are liable. For example, Whiskey Row is being sued for wrongful death as we stand here today. But what this bill aims to do is keep the patrons safe through de-escalation and through training to help the security guards not put the patrons in peril, such as this situation where they sat on the young man and literally suffocated him.
Representative Todd.
Thank you, Mr. Chairman. Wouldn't the business owners already have an incentive to incorporate some program like this based on the existing liability that they already have and an insurance policy they probably have for that liability?
Representative Beck.
And Chairman Todd, you would certainly think so, but this is just making it clear that in the training that's required, that they will have that type of training. But I agree with you. If I was running a business, I would certainly make sure that the security guards that I hired were trained properly on de-escalation and helping keep patrons safe. That's only good business. And I agree with you there. Unfortunately, for example, this particular case, that fell through the cracks.
Representative Todd.
Thank you, Mr. Chairman. And as you said, this makes it clear. It actually requires it. It doesn't just make it clear. I think it's taken a good idea that a business should consider to implement and requiring it in our code. And I think that's, to me, crossing the line of something that we probably don't need to really do. They already have a liability that exists under the law now, and they have to recognize that. And cases like this that are being brought obviously will bring that to the forefront. And I would think that would make them even more aware, even their neighbors more aware that we might need to take some additional measures. So I just don't see this see it as a good idea to put this into code when it's more of a common sense, practical matter that they should be doing on their own to make sure their liability is reduced as much as possible. So thank you, Mr. Chairman.
Thank you. Representative Beck, follow up.
I agree that it's common sense, but a lot of times we have to put common sense in the code to make sure it gets done.
All right, thank you. Further discussion on House Bill 2283. Seeing none, we're now voting on House Bill 2283, moving on to full finance. All those in favor say aye. Aye. All those opposed, no. The ayes have it. House Bill 2283 moves on to full finance.
Thank you, Mr. Chair and committee.
All right, that brings us to item number 8 on our calendar. Item number 8 is going to be House Bill 2862 by Chairman Dixie. Do we have a motion and a second? You have a motion and a second. You're recognized for a brief description.
Thank you, Mr. Chairman and committee. This bill requires the Division of TennCare to designate continuous glucose monitors as a diabetic supplies on the state preferred drug list formulary. It requires TennCare to make CGMs available to enrollees with diabetes who are insulin dependent if medical necessary. Basically what it does, it allows you in real time to check your blood sugar. I'm actually wearing one right now. And it's been helping me out. So, and I look at I have my wife listed as so I can share it. So if something happens to me, it'll be alerted. And so I can look at it. So my blood sugar right now, it's a little high, but it's at 138, but it might be because I was rushing to get here. But what it does, it allows people to monitor and check their blood sugar on a regular basis. A quick story, about a month ago, I wasn't feeling too well and I didn't know why. And so I just laid down because normally I'm pretty in tune with my body. But my wife said, have you checked your blood sugar? And I did, and my blood sugar was extremely high. But sometimes when you have diabetes and your blood sugar it gets high, you don't think clearly, you get cloudy. And normally I'm on top of it, but it didn't. But what this bill would do would lower the monitor cost from about $1,500 to about $665 per unit. Currently, TennCare contracts with managed care organizations or MCOs to deliver the glucose monitoring for insulin-dependent diabetics. But right now, it's done as a durable metal. It's done through the durable medical equipment model, which is you have to go see a doctor, and then they have to order it, and it takes about a month to get it. This would allow you to go to a pharmacy, get it just as if you would get any prescription, any ordinary prescription that you take for like blood pressure medicine or any other kind of medicine. This pretty much almost eliminates the sticks and pricks of the fingers that we do on a daily, multiple times a day. So it's really been helping me out a lot. But this would save the state money. And with that, Mr. Chairman, I'll stand to take any questions.
All right. Thank you, Chairman Dixie. Members, you've heard the description of House Bill 2862. Any discussion? Seeing none, there is a cost associated with House Bill 2862. We will have to place it behind the budget, consider it at a later date. So without objection, House Bill 2862 will go behind the budget. All right, that brings us to item number 9. Item number 9 is House Bill 1321. I have a request to roll this 1 week. So without objection, House Bill 1321 rolled 1 week. That brings us to item number 10. Item number 10 on our calendar is House Bill 2397 by Representative Mitchell. Don't know that he has got here yet. So without objection, all right, we'll give him a little bit of time. So item number 10, House Bill 2397, without objection, will be rolled to the Hill. Without objection, rolled to the Hill. That brings us to item number 11. Item number 11 is going to be House Bill 2456 by Representative Sparks. You have a motion and a second. You are recognized, sir.
Chairman, I was going to ask, is it possible to take up 2253 first, knock that one out? Because I've got someone that's going to testify on the next bill.
Yeah, we can. All right, members, we're on item number 11, House Bill 2456. We got a request to roll this one spot without objection. So moved. We are on item number 12, House Bill 2253 by Representative Sparks. Do I have a motion to second? We have a motion to second. You're recognized for a brief description.
Yes. Basically, what this bill does requires LEAs to classify school nurses as licensed personnel for salary purposes. The last few years, it's been shown that how critical school nurses are. There was a study conducted in 2020 by Chairman Doris Gresham of Education and Chairman Kumar that only a third of our nurses in Tennessee are placed on a certified schedule. And in fact, the study also reported that 2/3 of our school nurses hold an RN or higher level of education, meaning they are similarly educated as our CTE teachers who are paid the same as other certified staff. This comes to fight the fact that school districts actually receive more money for school nurses than they do teachers. School nurses are paid from the classroom component at a rate of 75% as opposed to 70% of the districts that receive through the instructional component for teachers. Furthermore, Members, nurses, and teachers are treated exactly the same as the state's retirement system. TCRS, as districts are required to contribute the same amount of money for nurses as they are teachers. But that's what this request is.
All right, thank you, Representative Sparks. Members, you've heard the description of House Bill 2253. Any discussion? Seeing none, there is a cost associated with House Bill 2253, so we will have to place it behind the budget and consider it at a later date. So without
Yes, sir.
objection, House Bill 2253 will go behind the budget.
Yes, sir.
All
Thank
right,
you,
that
Chairman.
brings us back to item number 11. Item number 11, again, is House Bill 2456 by Representative Sparks.
Yes.
You have a motion, a second. You are recognized on House Bill 2456.
Yes, Chairman and committee members, if I can give you a little brief history of this piece of legislation. About 3 years ago, I was kind of dealing with struggles in my life you've heard me talk about my sister that's in a nursing home, had a brain tumor. In fact, I was sitting about where Camper is when I got the phone call. She had a bad fall and had a brain bleed and was in a coma on life support for 2.5 months. Then I remembered I prayed over. Believe it or not, she came to. I know it sounds odd. She came to. She started talking. And now she's in a nursing home. Sadly, lost everything to her name. And my sister worked for an insurance company. That was what was wild. I was really disappointed with the insurance company. And got a mother in a nursing home. So I'm kind of seeing struggles in our lives with many of us deal with family members, especially when you start getting over 50. And so I called Ralph Weber here that owns a company called MetaBid. He's a healthcare consultant. And I just said, Ralph, what's up with healthcare? What's going on with healthcare? And I said, what can we do as a state to just shed more transparency, just add free market principles? And he brought up reference-based pricing. Well, I didn't know what reference-based pricing is. Most of us in this meeting, this room today, don't really know what reference-based pricing is. But I think reference-based pricing does shed some light and full transparency on healthcare. If you look at products and services in this world economy, I don't think you'll find anything that's more jacked up and messed up and screwed up than our healthcare system, whether it's PBMs, whether it's my sister that lost everything to her name, or other areas that we've all dealt with. And so that's what led to the legislation. That legislation led to a summer study. The pandemic happened, so that kind of set us back. And I'll let Ralph, who's on the list to testify, speak to what else led after the summer study, Chairman.
All right, thank you, Representative Sparks. And we do have a request for testimony from Mr. Ralph Weber. So members, without objection, we're going to go out of session. So without objection, we're out of session, and we will ask our guest to please come up to the podium. If you'll just identify yourself, give us a brief introduction. You'll have 3 minutes. Thank you, sir.
Thank you, Mr. Chairman, committee members. I'm here to speak about the House bill that Representative Sparks has introduced. Okay, it's working now. Simply, the bill asks that the state health plan be sent to TASER study. When Representative Sparks introduced House Bill 1366 in 2019, he requested some information from TN Finance. What we got from TN Finance was the billed charges for the plan year 2018, covering 139,000 state employees, schools, and higher education employees, total of 280,000 people. The billed charges were $2.7 billion, and the cost of the plan was $1.6 billion, so roughly 40% less than the billed charges. But within some of the procedures, we saw a huge variance in pricing. For example, CT scan of the abdomen, the average price was $635. The high was $19,200. For a colonoscopy, the average was $1,212. The high was $17,341. And within colonoscopy, what was very interesting is every provider that was over $10,000 was rated 2 to 3 stars by Medicare out of 5, 2 to 3 stars on quality, whereas everybody under 5,000 was rated 5 stars. So the less you paid, the higher the quality. So they were paying these huge charges for lower quality providers. The initial bill called for reference-based pricing to pay providers at whatever Medicare pays the providers plus an extra 75%. TN Finance said that we're only paying providers 150% of Medicare right now, so they put a fiscal note on it. So the bill was amended to reduce the costs. At that time in 2018, TN Finance said that they paid out-of-network providers 6% less than in-network providers. So simply changing to all out-of-network providers would have saved the state $96 million a year. So there was definitely a need to have further study. Chairman Martin Daniel became a co-sponsor of the bill, and he asked for some more data on the spending. And as soon as he asked for that, a couple of lawsuits were filed to suppress the need to disclose that data. As we studied further, we found more variance in pricing. The TN Finance said that they were aware of it. What reference-based pricing does, very simple, is it sets the benchmark. The benchmark is what Medicare pays hospitals and doctors for procedures and surgeries, and it sets that plus a margin. When we looked at the data that TN Finance presented that said they paid basically what Medicare paid plus 50%, I said, well, let's just cap it at that. Let's not have somebody being paid 3,000% more. Why should anybody be paid more, $19,000 for a CT scan? Some of the providers were paid more than they billed. They sent in a bill and they were paid more than they billed. I mean, sometimes I'll leave a tip if I get good service, but I'm not going to pay more than I'm billed. So there were a lot of erroneous charges.
Mr. Weber, your 3 minutes is up. So if you want to just make a final statement, please.
Final statement. Attorney General, I understand, did an audit and has the results. They haven't been released yet. I think the Tasser study will take that into account, as well as ask for some more data on spending, and hopefully will save the state definitely more than $100 million a year.
All right. Thank you, Mr. Weber. And before you leave, members, any questions or comments for our guest? Seeing none, thank you very much for being here. I actually sat on the insurance committee a couple years ago and heard your testimony. So thank you again for being here and your time. Members, without objection, we're going to go back into session. Without objection, we're back in session, and we are back on the bill. Representative Sparks, any follow-up?
Well, I was just going to mention, we did send a letter to Herbert Slattery, the AG, requesting the findings of the audit that we paid for. I think this committee voted for that. I believe it maybe was 2 years ago. The audit did cost us some money to get implemented. But I wanted to share with you, even the Bible talks about, and Luke talks about, suppose one of you wants to build a tower, wouldn't you first study and estimate the cost to see if you have enough to complete it? I think all we're doing is slowing down, sharpening our axe, and studying this. And if Tasser says, look, there's nothing to this, it doesn't help transparency, I'll leave this alone. You won't hear from me anymore. I think something positive will come out of this. The leading cause of bankruptcy is healthcare cost. I didn't know this till I started researching. We spend more money on healthcare than any other country on the face of the earth. That just shocks me, because we should have efficiencies. We've led the world in military, we led the world in production and technology, so many advancements, but in healthcare, we seem to drop the ball. And I often think of my sister. She was a former journalist. She didn't want to go into journalism because of the fake news. So she went into insurance, and they left her high and dry. That's what bothered me. So I'm asking for y'all's consideration on this study. Thank you.
All right. Thank you, Representative Sparks. Members, you've heard the description and you heard the testimony. Any discussion? Let's go to Chairman Williams.
Thank you, Chairman. Thank you, Representative Sparks. Very important subject matter, as you, your presenter testified and you stated earlier. This is something that we've been studying Tasser, not specific to this data, but this realm have been for a while. This committee is tasked with sending bills for Tasser study. There is a calendar this afternoon, but because of the timing and us being at the end, the late hour, I guess you could say round and third hit at home, we're not able to refer it to that calendar, so we're having to transact business here. But of those 4 bills on that calendar, we're only supposed to take 2 and send us Tasser, and then the other 3, I've met with the other members and advocated to them and saying, as a member of Tasser, I will communicate with Dr. Lippard with the idea that we would study these for that. And so as you and I discussed earlier today, that's kind of the intent. The other two are the ones that the committee felt like that they wanted to study in TASER. And so because of that reason, I'm going to make a motion to either you can take it off notice and I'll advocate with Dr. Lippard and TASER as a member of TASER, or we can send it to summer study and vote to send it to summer study, and we can take it to TASER. Obviously, you and I came in together. We served for a very, very long time. I respect you. I'm going to give you the opportunity of what you think would be best for us to do.
Well, I think the best plan is if we can save $100 million to move forward. I talked to Dr. Lippard yesterday. He was fine. He didn't see a problem. We just met with the speaker. Didn't really see a problem with studying it. All we're doing is slowing down, studying our costs. If we come back, maybe it's not $100 million worth of savings. Maybe it's 5 million. Maybe it's $1 million. But I think that time is well spent for us to study the costs. I'm at the mercy of the chairman and the members of this body. Remember, y'all allocated $400,000, if I'm mistaken, to conduct the audit. The audit is in the AG's office. We're waiting on him to release the findings. I think this correlates with all your efforts from 2 years ago. So I'm at the mercy of y'all.
Chairman Williams.
Thank you. Thank you. I think I got an answer out of that, Representative Sparks. And so, Chairman, I'd like to make a motion to send this bill to summer study.
We got a motion. Is there a second? We do have a second. Any discussion on the motion? Hearing none, we're now voting on sending House Bill 2456 to summer study. All those in favor say aye.
Aye.
All those opposed, no. The ayes have it. House Bill 2456 goes to summer study.
All right. Thank you, sir.
Thank you. All right, that brings us to item number 13. Item number 13 is House Bill 324 by Representative Baum.
Motion.
Thank you, Chairman Hicks. This is the bill that would change the grading scale in Tennessee from a 7-point scale to a 10-point scale, which all the states surrounding us have and most of the other states in the United States. This is so that Tennesseans will not be at a disadvantage relative to applicants from other states when they apply to colleges and for scholarships. For example, if a Tennessean has a 92 and somebody from Kentucky has a 92, the Tennessean would have a B and the fellow from Kentucky would have an A. We don't want Harvard to think the applicant from Kentucky is better.
All right. Thank you for this description, Representative Baum. Members, you've heard the description of House Bill 324. Any discussion? Hearing none, seeing none. The bill does have a cost associated with it, so we will have to place it behind the budget and consider it at a later date. So without objection, House Bill 324 will go behind the budget. All right. That brings us to item number 14. Item number 14 is House Bill 2384. That is by Leader Gant. This bill was previously considered and placed behind the budget. It has now been funded in the administration amendment, and we can now move this forward. So any objection to reconsidering our action on House Bill 2384? Seeing none, House Bill 2384 is back before us. All right, we have a motion and a second on House Bill 2384. Leader Gant, you're recognized.
Thank you, Mr. Chairman. I'll be very brief. This is brought by our treasurer, Treasurer Lillard. It authorizes the state treasurer to develop and implement and administer a program to award grants to local governments and volunteer fire departments to fund a length of service award known as LOSAP beginning in fiscal year 23-24.
All right. Thank you, Leader Gant. Members, you've heard the description of House Bill 2384. Any discussion? Hearing none. We're not going to, nope, he doesn't want to run the amendment. All right. Any discussion? Hearing none, seeing none. We're now voting on sending House Bill 2384 on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. We're sending House Bill 2384 to full finance. All right, that brings us to item number 15. Item number 15 on our calendar is going to be House Bill 2609 by Chairman Hazelwood. You have a motion and a second. You are recognized, and it looks like there's an amendment drafting code 015656 that rewrites the bill. Is that correct?
That is correct.
All right, is there a motion and a second on the amendment? You have a motion and a second. Let's go ahead and get this put onto the bill. Any discussion on the amendment? Hearing none, seeing none. We're now voting on amendment 01565 to House Bill 2609. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended. You're recognized, Chair Lady Hazelwood.
Thank you, Mr. Chairman. This bill just basically would do for the Chattanooga Lookouts, similar to what we did for the Knoxville Smokies last year. If and when the Lookout Stadium is built, then this would allow the Lookouts to keep the sales tax from within the stadium. There is one difference in this amendment that I think makes it better, and that is that the county would still continue to collect the portion of the sales tax that's generated for education. That would still go into the education pool. We did not do that with the previous stadium bill that we had. With that, Mr. Chairman, I would renew the motion and ask for passage.
All right, thank you, Chair Lady Hazelwood. Members, you've heard the description of House Bill 2609. Any discussion? Seeing none, we're now voting on House Bill 2609, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 2609 moves to full finance. Members, that brings us back to item number. We're going to go to item number 10. Item number 10 is going to be House Bill 2397, and we are without objection. We're going to place House Bill 2397 behind the budget. So without objection, seeing none, House Bill 2397 goes behind the budget. All righty. That brings us to item number 5. Just a second here, and I think Leader Lamberth, I think you and Chairman White are going to.
Yes, sir, Mr. Chairman. With your permission, we'd like to kind of tag team this, Chairman White and myself.
Give us just a second to get. All right, we are on item number 5, House Bill 2143. You've got a motion and a second. You are recognized, sir.
Thank you, Mr. Chairman. And I know this has been through approximately 6 or 7 weeks of committee hearings and education, the better part of 6 months on working with Tennesseans from Mountain City to Memphis and lots of different groups. So I know you guys have read this and know this thoroughly, so I'm not going to give a big, long recitation of what it is, but it is a change from the BEP formula to a new funding formula that is student-centered that creates a base funding of $6,860 per student. And that is a big shift from what we do now. We fund classrooms, we fund schools, we fund systems, but we don't focus on funding students. And as part of that, it would also focus on weights above and beyond that for economically disadvantaged, concentration of poverty with the different school districts, sparse school districts, small school districts. I mean, if you're in a sparse school district, quite frankly, it costs more to run your buses. They run longer distances. I mean, it's just, if you're in an economically disadvantaged area, those children need additional resources. Some of this is covered under the current formula. Some of it is not. So this proposal will be a significant step forward and also will focus exclusively on additional dedicated funds for K through 3 literacy, which our numbers are abysmal on literacy right now. This will drastically improve that because we're not just going to allocate the money. We're focusing on that. We're making that an area of emphasis, as well as 4th grade tutoring, CTE programs, and preparation kind of top to bottom of just raising the bar for our educational institutions across the state and leveraging at the end of the day on this an additional $1 billion of state funding in the 23-24 budget. And that will raise the total up to about $9 billion in total K through 12 spending. It's a significant step forward. And it's a huge amount of funds that are taxpayer funds. And so part of this is more accountability than we've ever had at the state level to ensure that these funds are being utilized to literally leverage for our children's future and a better education. Mr. Chairman, we stand for questions.
All right, thank you, Leader. And there was an untimely filed amendment. So I'm going to, at this time, recognize Representative Freeman.
Thank you, Chairman, and apologize for the late filed amendment. And my understanding is the exact same amendment is in the Senate, and so with that, I withdraw it.
All right. Thank you very much. So without objection, amendment withdrew. All right, that puts us back on the bill. Members, you've heard the description. Any discussion? Representative Hall.
Thank you, Chairman, and sponsor. Thank you very much. I do have a question that may get into some of the minutia of it, if it's all right. Some of our county leaders have asked some questions, and it may go into depth on a county level funding and schools and students that may be transitioning from one county to the next. So I appreciate your indulgence. If a student leaves a local school system and attends a charter school in the same county, does all the state, federal, and local match dollars follow the student?
Yes.
Okay. If a student leaves a local school system to,
You're recognized. Let's do this because I know this may be a little bit of discussion on this. As long as we don't get into a running debate, once you're recognized, you can go back and forth, and I'll let you know if you begin running off. So go ahead.
Thank you, Chairman. I've got 3 more questions and maybe a statement at the end. So thank you. And thank you, Leader, again. If a student leaves a local school system to attend school in an adjoining county, does all the state, federal, and local match follow that student as well?
And I can get some additional details on that, but in essence, yes, if a student leaves one school system and goes to another, just like now, it would follow with them. The timetable on this is a little quicker, but it's not immediate.
And I think, and I'll answer part of that question. I think there is a year time frame that the departing school district has to be made whole. I think may help that answer some. Thank you.
Yes, sir.
Thirdly, if a student leaves a local school system to attend a private school, does any of the state, federal, or local match follow that student?
No, sir, it would not under this bill. If they go to a private school, they've left the school system. And again, there is some lag time on when that school system would go down by one student, because similarly to the BEP, a large portion of the BEP is how many children are in those schools. And so with this, we're funding children and children's education. And so it would eventually reduce that district's funding, but it is not immediate.
And that goes to my last question of how those funds are calculated to the school district. I think you just answered that those funds will be calculated not in that current year, but in future years that would occur.
Yes, sir, that is correct. And again, they all have to build a base budget. And so that's why that 6860 number is very important. And over time, obviously in this new formula, which is why the implementation of this, I mean, it's, if we're able to pass this year, this gives everybody, 6-8 months to be able to run through every aspect of this, run those numbers, build their base budgets around it. And there's approximately $500 million for CTE funding in this budget that is a set aside. So that $1 billion, that and an additional 500 is set aside for next year's base budget. But all of our school systems will have an opportunity to look at every single one of those numbers and run through that. What we didn't want to do is exactly the questions you're asking, which are right on point as always, is to pass this right now, and it goes in effect July 1. My school district and yours, they're already 90% into the process of building their budget for this year. So while they all have filed lawsuits saying that the BEP is not sufficient for their needs, we are working on a new formula, but it is for next year to give them that kind of lag time.
And thank you, Leader. And I appreciate that and the indulgence. And I think I knew what the answers were going to be. Just wanted to ensure I didn't want to blindside anyone with those questions. I do want to offer an abstract thought as we're looking at the funding. And I understand the need and desire of funding an additional funding mechanism for folks living in poverty, children living in poverty, and we're certainly going to do that, and that's part of it. But at some point in time, as we're working through other pieces of legislation, the Tennessee Opportunity Act, some of our TANF funding, as we're looking to raise all families out of poverty eventually and help our working families, and I'm excited about the opportunities that we're going to have with the Opportunity Act that Representative Terry passed last year, and we've been working on for the last calendar year. At some point in time, I hope that we can get to the point 10 years from now, 15 years from now, 20 years from now, where funding students in poverty is not something that we're doing, that we're rising that the tide is rising all boats, and we don't see that as such a huge funding mechanism. Thank you for allowing me to say that, Chairman and members.
Thank you. Leader Camper.
Thank you, Mr. Chairman. Thank you, Mr. Sponsor, for the bill and the opportunity to talk about it here in finance, or in budget, I should say. You mentioned at the top of your comments that we've been looking at this for about 6 weeks or so. And that goes to my question. It appears to me that this is a monumental step we're about to take. It's transformative. It's going to change how we fund education for years. And there's a lot of us who believe that we might be rushing it. And I understand that the commissioner and administration feels as if, the timeline also includes the ad hoc committees, and I get that. But if we look at, these transformative changes in education we've done over the years, it's taken maybe 2 or 3 legislative sessions to get it done because it is major. It's going to affect our kids and parents and teachers for years. So I'm concerned about what appears to be a rush to get it done. Would you care to expound on that, talk about that, maybe assure the people, that this is something we absolutely have to get done now? Why can't we wait till next year? I mean, you talked about it at the top, so I'd appreciate your comments on that.
You recognize.
Leader, thank you so much for that question because, there have been, as you said, committees that were put together over the last 6 months. But, you and I have been here quite a while, and I've been here for 10 years. And every single year this comes up. Every single year. It's, hey, we got to do something with the BEP. It's not working. It's not funding our school district properly. I've heard both Republicans and Democrats say, look, the BEP is not working for our schools. It's not working for our kids. And so I personally, my kids at this point are in middle school and elementary school. The whole time I've been here, they've just gotten a year older in a school system that doesn't have a funding formula that's working well for them. And again, that's across the board. I've heard from everybody that they don't like the way the BEP works. And I've heard many people say they don't understand the mechanisms within the BEP. Now, I will say that just takes time diving into it. But when you really dive into it, it does not fund children, a child's education in the way it should so that they get what they need to succeed. It just doesn't. It's a 30-year-old formula that doesn't meet today's standards. So what I would say is, as far as rushed, it absolutely has not been rushed. This has been years in the making. It's been 30 years in the making, quite frankly, but it's specifically since last year coming into this year. After we passed several educational really improvements within the code, the question came down to, okay, we've done all this other stuff to try to come out of the pandemic and make sure our kids bounce back. What are we doing about the base funding? Are we investing enough in K through 12 education? And is the state doing it in a way that's going to achieve better outcomes? That's why this is needed right now. That's why we cannot wait. Because I've heard people say, let's kick, and you're not saying this, but I've heard people say, let's kick the can down the road. Let's study this over the summer. I've gotten emails. Y'all have gotten emails on that. Those are folks that are not willing to step up and do the difficult work that we were all elected to do. We're sitting in these seats right now. If we wait a year, my kids went one more year in the public school system without a funding formula that will genuinely address their literacy needs, will genuinely look at those kids that have difficulty in school because of their both home life and how they came into the school system. We have children that have a variety of learning needs that we're not funding right now because we've got the BEP. And so we're stuck in that outdated model where this can spring us forward. So why it's needed right now is because every single one of us should care about the kids that are in school, especially those parents that are out there that are begging for a better model that's going to focus on K through 3 literacy, that's going to focus on CTE. We've got roughly 70% of our kids that are not going to go on and finish out a 4-year degree. They need to get an education that's going to lead to a career, because you've only got 25 to 30% of the jobs out there that require a 4-year degree. If you're going to be an architect, an engineer, a doctor, a lawyer, if you're going to pursue one of those pathways, absolutely, you got to go all the way in school. But for kids like my nephew that's graduating high school in the next few weeks, he wants to be a lineman, and he's going to make a ton of money doing that. That is a highly skilled trade. This prepares all of our kids for whatever pathway they want to go into in a way the BEP never dreamed of, because they didn't think of it 30 years ago. So the reason it's needed right now is our kids can't wait any longer.
Thank you for that response. As I remember the conversation around BEP, it was more that, and I heard it every year, similarly like you did, it was really more that we weren't fully funding it. And so there's this thought that it may be an outdated formula, and it may be, but part of the problem was we weren't fully funding it. So we could fully fund it and yield some of the very results that you're talking about And we could have been yielding those results over the years if we had fully funded the formula. I'll move past that point. But you also mentioned the base amount, and it's about 68, almost $6,900. In the BEP, as it's funded, it takes into account the student, the teachers, the nurses, and that. So could you talk more about this base formula and how do we account for increases over the years? What goes into to keep up with inflation and all of these factors that could affect the base funding formula?
Thank you, Mr. Chairman, and thank you, Madam Leader. So I will say this, if, and we have fully funded the BEP. I mean, we've had that conversation every single year. When you look at an evaluation of what fully funded the BEP is, it all depends on who's doing the evaluation, right? So, I mean, you got folks that evaluate it and say, hey, look, you didn't fund the fully fund the BEP, and there are other folks out there that are saying, nope, here's the evaluation, we fully funded it. So it comes down to, again, the children and the teachers that are in the school that are trying to make sure that this next generation's in better shape. And we both agree on that. Multiple analysis on the BEP have said, if we put $1 billion extra, okay? So if we overfund the BEP, okay, it is a massive, massive tax increase on our local governments next year. I mean, if you put $1 billion into the current BEP formula at those matches and that local match equation as it is right now, it will be a massive burden on our local governments. The TISA program changes that, and it makes it a significantly less burden on our locals. So the state is stepping up and doing much more, and our local districts will not have to do as much. And that's a good thing, at least in my mind. And so when we've talked about fully funding the BEP over the years, that's been most of the conversations I've heard is, the state needs to step up more and not require as much out of the locals. Now, the base formula of $6,860 per student figured in most of what you've said already, and that's how it came to the base. Now, they tore it down all the way to the bare bones and built it back up to that level, but we're still leaving that in local control. If a local government, just as in Sumner County, our school systems go above and beyond. If they want to have smaller class sizes, if they want to have more nurses, if they want to have more guidance counselors, they can always do more. But yes, in that base is most of what you just mentioned.
Leader Camper.
Thank you, Mr. Sponsor. That's all I have, Mr. Chairman.
And I guess to expound on that, thank you, Leader Camper, just to go a little bit further, talking about that this has been rushed in 6 months and the BEP Review Committee, I'm just curious, and this may be for Chairman White, can you talk a little bit about how over the years, what the BEP Review Committee has always recommended, how has that fitted into the new TISA funding formula? Talk a little bit about that when we talk about being rushed. I mean, we literally have kind of been working on this since its inception back in the 90s. So, Chairman Watt.
Yeah, thank you, Chairman. And to that point, there's been a BEP committee, a task force during the days of Haslam. We've been looking at this. The 9 years I've sat on the chair in the education committee as either sub-chair or chair, this discussion has always been for us. I think the point that we need to make more than anything is that the time is ripe. We could say, let's go home at the end of April, 1st of May, come back in January. We're going to be no closer. We'll have a turnover of probably 20 or more representatives. We got to bring the conversation and get started again. The timing is right now. Ever since the 26 committees that came together last fall have brought their reports to us, we've been working intensely on this since January. 3 hard months. I'm into my 4th notebook of changes and additions and listening to conversations. And so the timing is right. Now, back to your question on the BEP, I want to make this point. We will never, to the satisfaction of locals, fully fund BEP because it's based upon ratios. We fund resources. 1 teacher to every 25 students, or 1 teacher to every 20 students, or 1 nurse for every 3,000 students. As long as you try to fund based on ratios, you never fully equate it. We have 11,000 teachers hired across the state that are outside the BEP formula of what we do. So every year we sit in education committee and we look for another $40 million to bring the ratio of nurses from 1 in 3,000 down to 1 in 750, or we try to give raises to teachers. It just doesn't work. So this formula, the reason I really like this particular formula is because we are funding based upon the needs of the students. You have your base, you have your weights, you have direct funding. And so a school district that is really sharp is going to take this and they're going to do wonders. School districts that don't, we as a state have one more form of accountability. That accountability is now the funding. Right now, the only accountability is really testing through this end of course, the state test. So we're collecting data and we're saying, oh, you're only doing so well because your students are only doing so well. Third grade proficiency reading, only one in three. Now we can say, we are funding you fully based upon your student needs. Why are you not doing better? So there's a lot of advantages there. But back to the chairman's question, we've discussed this year after year after year. And so going to a student-based funding formula, in my opinion, is just something that fixes so many problems. It will not start until 2023, 2024. So whatever we implement now, it's got a whole year. And if we come back in January, we see something that needs fixing, we can work on that. Does that help?
Yeah,
Chairman?
thank you. Members, any discussion? If you want to be recognized, please let me know. I do have a question. Let's not jump too far ahead in fiscal year 24. Let's back up just for a second, fiscal year 23. I want to make sure I'm clear on this one. So the monies that, I've heard it said that high schools are going to be getting $1 million, middle schools are going to be getting 500,000. I need a little more clarity on that. And I know the department's sitting out there waiting patiently and for our questions, and you guys have been doing a great job, but I think we're going to have to call them up because I really would like to get a little more clarity on that. So if the department would go ahead and make your way up, I hate for y'all to walk all the way over here and then not get to say anything. So, all right, members. So without objection, we're going to go out of session. So without objection, we're out of session, and you all know the deal. So if y'all would please go ahead and introduce yourselves.
Yes, sir. Penny Schwinn, Commissioner of Education.
Sam Piercy, Deputy Commissioner.
Mary Ann Dursky, CFO.
Charlie Bufalino, Assistant Commissioner of Policy and Legislative Affairs.
And thank y'all for being here. And let me say this, and I'm not going to embarrass her, but I do want her to know. Folks, if you all want to know probably the most leaned on person in your school districts, you can look at Miss Mary Ann Dursky, because that is her. You think your phone rings a lot. I can assure you her phone rings a lot. And sometimes it's actually me calling. So it's good to see you, Mary Ann. Thank you for being here. So let's just open that up. And Commissioner, if you want to take a stab, or if Assistant Commissioner Piercy, whichever one wants to take a stab, talk us through the $1 million that's going to high schools versus the 500,000 that's supposed to be going to middle schools. That's still, to me, just still a little bit confusing.
Yes, sir. So appreciate that. One of the things that I want to make sure to clarify is the governor's proposal for $500 million for CTE programs would be separate and apart from TISA. So just making sure that that's a one-time fund that he is proposing. In that proposal, it would include $1 million for every high school. It also includes $500,000 for every middle school or mixed model school. Those are our schools that are maybe 6 to 12, 8, 12, things like that. And then we have a few schools, just a small handful that are under 100 students. It does allow for $200,000 for those very, very small schools. The purpose of that is for the one-time costs of expanding innovative programs. You think about some of the early grants that we did under the federal relief funding. We were able to fund over 20 innovative school models across the state. They're doing incredible things across the state in all different types of sectors. Some are doing ag tech, some are doing teaching as a profession. We've got forestry in the Southwest, et cetera, et cetera. And so this essentially was looking at the early results of that pilot and that group of districts that are working on innovative school models, and then saying, how can we expand and reshape and rethink the opportunities available for all students across the state? The reason for the consistent amount for every high school and every middle school is that these are startup one-time expenses over a period of time. Machinery is going to cost the same no matter how many students go to your school building. And we wanted to make sure that there was equitable access and opportunity for all students, whether they went to a very large high school or a very small high school, that every school would have the opportunity to start new and innovative programs. We do expect the majority of the funds will be for the one-time equipment, machinery, those types of costs, as well as the cost of building up programs and staff over a period of 3 to 4 years.
So walk me through, how is a middle school? Because I think about in my school district and $500,000. And so what is the expectation? Like for my school district, it's career exploration. That's kind of what we would be focused on, identifying that, getting them prepared to go into the high school. So walk me through, because 4 years, I don't care how many years you give them, middle schools, what is still the expectation? I don't think we're going to teach sixth graders how to weld. So help me through that right there.
Sure. Great question. And one of the things that we heard over the last specifically 12 months in particular, especially from our school districts, is that they wanted to have more opportunities for exposure and access in those middle school grades. But oftentimes that exposure and access was limited both because of financial reasons and also because transportation. You either had to bring high school students and teachers to the middle school, and you might do a career fair, or vice versa. Many of our districts are actually trying to think about building 5 and 6 year pathways so students could start in 6th or 7th grade. They have a lot of their pre-courses that they can do in middle school, and then they are ready to really dive into high-level coursework starting as early as 9th grade. We also have some programs where districts were thinking about 5-year tracks. So you have some career exploration that might happen in 6th and 7th grade. Students have an interest. They're able to take 2 or 3 different classes in 8th grade, really know if they like it or not before they actually enter that pathway in 9th. What we have seen trend-wise is that once you enter a program of study, if you like it, you stay, but if you don't, you're either behind because now you have to transfer in your sophomore year, you don't get 4 full years of that coursework, or you kind of have to stick with something you don't like, you're not going to enter that. So this is really about a bunch of middle schools who haven't had the funding before being able to start that now.
Okay, thank you very much.
Yes, sir.
Further discussion. Leader Camper.
Thank you, Mr. Chairman. I have a question about inflationary costs. Can you all
Yes, ma'am.
talk about how we plan to deal with the inflationary costs? Like right now, I think we have proposed in the budget a teacher increase of about 4.5%, and we know inflation is at about 8.5. How do we plan to deal with inflationary costs over the years?
You're recognized.
Yes, ma'am. And just to clarify, are you talking about how do we currently do it in the BEP or how it's proposed to be addressed in TISA or
How-
both?
You could do both. I was talking about TISA, but you can give us a comparison.
Okay, great. I will talk a little bit about how that would be under TISA, and then we'll turn it over to Marianne to talk a little bit about how that works in the BEP. So under TISA, the process would be each year as you all think about appropriations and how much you would want to put additionally into public education, that would be something you would put into the base. The base then allows you to have that multiplier effect within the weights. So for example, I think the statistic we always give or have been giving has been, if you all decided you wanted to put $100 million towards teacher salaries or $100 million in the base, that's pretty consistent with what y'all have been doing over the last several years. That actually leads to $217 million more dollars for public schools because of how much the weights end up increasing. So it's not 5% times 6860. It might be 5% times 6980. So you get a much larger amount of investment, and that helps to account for a lot of those inflationary components within a formula, gas prices going up, additional raises or increases for other staff members.
Leader Camper.
Okay, thank you. And so when you said we put in the budget, generally the governor is recommending to us a number. Are you putting it on the legislative branch to decide how much we want to fund? Or are we taking that power away from the governor and the administration to offer a number to us to consider? Explain that.
You're recognized.
No, ma'am. This is under the assumption that the governor would continue to propose a number and you all would, I'm just not making the assumption that you all just take that and rubber stamp it. So that's.
Okay, I was a little concerned with that. Yes, ma'am.
Leader Camper, is that it?
Marianne.
Oh, I'm sorry.
I was going to speak to the BEP.
Yes, you're recognized. Sorry, Ms.
Thank you.
Dursky.
Thank you. Currently in the BEP, we take a look at a number of the unit costs. And we look at typically a 3-year trend of what those actual costs were for materials and supplies, textbooks, professional development, those types of things. And we look at a 3-year average of what the districts actually spend and apply an inflator to it. We get the inflationary increase percentages from CBER, the Center for Business and Economic Research at UT Knoxville. We get other increases from, for example, Benefits Administration on the medical insurance premium and TCRS on the retirement contribution. They project out those future costs and we incorporate those.
Leader Camper,
Thank you. I appreciate your input.
Representative Hall.
Thank you, Mr. Chair and Commissioner and your team. Thank you so much for the time that has been spent on this. And to echo what Chairman Hicks had said earlier, this has been an ongoing process. I've had potential legislation from the BEP Review Committee for 5 or 6 years, and now it is being funded in the TISA plan. So thank you very much. Can you go down the road, since we've got you in front of us now, of some of the historical legislative initiatives that we've had, talking about school nurses, talking about school resource officers? Additionally, specifically, if we could talk about coordinated school health and the director positions within those, if you could walk us down the pathway of where those legislative initiatives from 5, 6, 7 years ago are going to be now in the funding formulas.
You're recognized.
Yes, sir. Happy to. So there's a couple of different things I would direct you to. I think to the chairman's point earlier, we've had a BEP review committee and pretty consistent recommendations for years and years and years, almost exclusively. And you can go back to the first one, I believe, in 2004, and it's a recommendation to get to the national ratio for nurses and counselors. We've seen some inclusion with RTI and technology. Those have been some of the big repeaters over time, as well as teacher salaries. Legislatively, I think we see the same thing. Typically, any kind of proposal related to getting that counselor or nurse ratio to what the national recommendation is. We've also heard more recently, of course, additional conversation around technology, and consistently over time, certainly about making sure that we increase educator salaries year over year. In this formula, in thinking about some of those additional components, when you look at the base of 6860, it's the 12th highest in the country, the second highest in the Southeast. It is $125 million more than those same components currently in the BEP, and that doesn't even cover the weights and the direct funding allocations. So it does allow for additional funding for those critical positions like counselors and nurses within our school systems. When you look at coordinated school health, school safety, and family resource centers, those are funded outside of the current BEP. One of the other things to note is that not every school district receives that funding. We have a number of school districts who do not receive funding for coordinated school health, for example. By bringing it into the formula, it ensures that every district gets funding for those critical programs, and it also ensures that the programmatic requirements within statute do not change. So everything that was already programmatically required maintains within current code.
Thank you. All right, members, further discussion, questions? Chairman Williams. Chairman Williams, you're recognized.
Thank you. Just had to go back to the CTE question a moment ago. There were some discussions early on about the $1 million for high schools, $500,000 for those hybrid models or straight out middle schools. I guess there was some discussion about whether the locals would be required to do a match or a percentage. Are these first dollars in, or is there going to be a match in the language? Because you mentioned earlier about grants. And so obviously, I don't think all of the middle schools in my district have a CTE program. And so, which is why I understand the 4 years. But if you could talk about the match, if there is one, what those responsibilities will be for the local LEA, that'd be great.
Commissioner, you're recognized.
Yes, sir. So there's no local match. These would be 100% state dollars as part of the planning process and support that the department would offer to districts, especially those who don't have middle school programs, for example. It is about making sure that there's a way to keep the program sustainable over time. So helping people with that planning if TISA passed, that there's some nice additional funding that can go and help with that sustainability. But it is 100% state funded. That ramp up is because we know that it's going to take 1 to 3 years at the middle school level, 3 to 4 years at the high school level to both plan, establish, and implement a full program that can then be sustainable over time.
Chairman Williams.
So in those analysis of these individual programs, your department's going to ensure that they're not making reoccurring expense commitments with any of this million, $500,000, $200,000 number. Is that correct?
You're recognized, Commissioner.
Yes, sir. So one of the requirements in the grant application is that they have a fully baked sustainability plan. So we would not approve the application or disperse any funding until we see exactly how they would support that with their existing funding or what they would expect their existing funding to be recurring over time, with zero expectation of additional funding for that particular program.
You're recognized.
So you expect most of these dollars to be spent on some kind of capital improvement or purchase of equipment or things of that nature, I suppose.
Yes, sir. We would expect that the majority is going to be towards equipment, materials, et cetera. We also expect many of our districts will bring additional staff or support to help with startup costs. A lot of times that is with local industry and business. You can bring them in. There's for contractors, or maybe you bring in, if you're starting a welding program, you bring in folks who are in that profession within the local community to help advise, et cetera. But they're all those one-time startup costs. I do believe the vast majority will be on machinery and equipment.
Chairman Williams.
One final question. As I served on the workforce, one of the 18 committees. It was fantastic. 5 o'clock in the afternoon. What a great time for a Zoom committee meeting. But anyways, that was a joke. But I will say one of the things that concerns me about this a little bit is we've done a great job. We heard from our bill sponsors about how we're funding education based upon not ratios, but upon kids. The big challenge I see or problem that might be with CTE money is I have 3 high schools in my county, in the LEA in my county. I have one that has 2,700 students, and I got one with 800, and they both get $1 million, right? The other one I think is around 400. So being able to deliver quality CTE for those 2,500 odd students for $1 million seems completely different than in Upperman, where we've got great facilities there, but there's just not as many kids or not as many users. So what's the argument behind just doing a lump instead of using the same $500 million, is what that is, per child?
Yes, sir. So it really is about those initial costs. So if you are, the last innovative school model I was in Macon County and Jackson County. They have a collaboration that they are doing. They've essentially, for teaching as a profession, they've created kind of a bus where you can go and students are able to travel to different schools and practice the art of being a teacher, which is very exciting. But the cost of that bus is going to be the same whether you are in a school of 2,700 students or you're in a school of 200 students. So knowing that the majority of those funds are going to be going to those one-time expenses that are going to cost the same no matter what, that was the thinking behind it, versus the formula, which is that ongoing sustainability. And that's where you see that per student funding, which really drives participation in those programs. So this is really about the cost is the same no matter how many students are at the school. Yes, sir.
Representative Freeman.
Thank you, Chairman. And my question is maybe a little bit more specific as it relates to Davidson County. My understanding is under the new funding formula, Davidson County will get roughly $50 million in new funding. Is that an accurate statement?
Yeah, we're going to get you the exact number, but it's approximately that much. Yes, sir.
And if we're looking at currently BP funds about 72, I'm seeing TISA, this is actually from your department, is going to generate about 778 to an increase of $48.8 million is what I'm seeing. So a little bit less than 10%. What portion of those dollars are locally funded versus state funded?
Yes, sir. So because we would use a TASER CBER combo, the percent that any local district would be responsible for. That share is going to be the same under either formula. It's calculated separately. Now, the total amount that is applied to is different. Under the BEP, it is every dollar within the formula has some kind of local share. That is either a 70-30, a 75-25, or a 50-50 split, and that's the statewide. Metro Nashville's proportion of that is going to be different, and that's fiscal capacity. That is the BEP or TISA. It is agnostic to the formula. It is actually one of the requirements that is outside of the control here. It's been ruled on previously. Under TISA, one of the benefits, and this is why all of our locals, when you see that graph of how much they're going to have to spend under the BEP versus how much under TISA, it is less under TISA for every district in the state. That is because we do not apply a local share for every component of TISA. We only do it for the base and the weights, meaning that the direct funding amounts are completely funded by the state. And that's why that local bill is going to be lower, again, for every district in the state. And I think we've projected out to 2030. Other organizations have projected that out to 2035. And that is consistent, again, every district for the next 13 plus years.
So do you have the dollar amount of what that actual dollar amount of the state share is?
We do, and those have been sent to all of our districts. Sam's going to pull up what that is. If you're interested in a particular year, I'm happy to give you that information as well if you're just looking for the first year.
First year's fine.
Okay, great. Do you have that? For Davidson County, $334 million will be state funded of the overall funding of 778.
And do we have a breakdown of what that increase is under the new funding formula versus BEP?
BEP would be, Davidson County would have a higher bill under the BEP than they would under TISA.
Okay.
They would have to pay more locally.
Okay, so the additional $48 million that will be generated under TISA for under this new program, what percent is the state portion versus the local portion?
43% state. So it's 43% state would be the additional. I want to just kind of separate the two parts of your question. So the first part is really about, for the new money, how much is going to be state versus how much is going to be Metro Nashville or Davidson County. So that's that just over 40% is going to be state. The remainder is going to be Metro. That being said, all the additional funding going to Metro, it is still going to be less under TISA, that bill that they pay back to the state, or the share that or the contribution, excuse me, that they're going to have to put in. That number is lower under TISA than under the BEP. So their percent of what they pay of the formula is going to be higher than the majority of districts in the state. And their bill is still going to be lower because of how TISA works. We do not apply local share to the entire formula. So they are going to receive more money and pay less locally.
Okay, thank you.
Yes, sir.
And Commissioner, can you just, so I know as it's went through the committee process, I know there's been a couple amendments go on. So what's the total, just to get on record, what is the total amount of the new education funding formula?
Yes, sir. So it's in the initial year, which would be this budget year, $750 million is put aside. It would be an additional just over $250 million in implementation. So in total, it's $1.05 billion approximately for the first year of implementation.
And then during that first year of implementation, how much is in the base?
In the base, it is $6.6 billion, sir.
Okay. And then
Just over.
And weights?
The weights altogether is going to be $1.756 billion.
And of course, direct is still 80 million. Is that correct?
Yes, sir.
Okay. And then just one thing about the ratios. With BEP, I know it was funded by averages and ratios, but so TISA is not using that to fund, but make no mistake about it, ratios are still incorporated in TISA because you're not going to have one teacher and 45 kindergarten students. So those ratios are still there. We're just not funding based on those ratios. So the funding, again, will follow the child. But again, those ratios, so we're not totally, you never get rid of the ratios. We're just not funding on ratios. So just want to make sure that that's clear. Members, further discussion? Yes, sir. Representative Wendell, you're recognized.
Mr. Chairman, would I be out of order if I introduce the ROTC for the University of Tennessee along with Colonel Whitson? Would you please make them welcome? And if you could introduce them, I hate to jump out of line,
Please
but I'm
do.
going to.
Please do.
I think they deserve that. And if you could Yeah.
Colonel, hold on one second. Turn that microphone on so we can all hear and get this on the record here.
Just tell us your name and what you're majoring in and what branch you want to be in. I hope
Absolutely.
it's the right one, okay?
Under pressure. My name's Noah Smith. I'm a senior at UT Knoxville studying marketing and supply chain management. Hopefully stay here in Tennessee, serving in the National Guard and doing adjunct general, so AG.
Fantastic.
My name is William Doro. I'm a freshman at UT Knoxville. I am studying political science pre-law, and I'm looking to join the JAG Corps in the United States Army.
Uh-oh.
Hi, my name is Gabby McEllier. I'm a junior, and I'm studying international affairs, and I'm hoping to do either logistics or air defense artillery.
Hi, I'm Cadet Ashley Fahey. I'm a freshman, and currently I'm studying kinesiology, and I plan to branch somewhere in the combat arms. We'll see.
Mr. Chairman, with your permission, they've got a challenge form they want to present to you. May they enter the podium and present that to you, Mr. Chairman?
Absolutely.
Is that out of order? Probably is.
It may be, but we're going to override and go ahead.
I want to make sure that he's also a member of the Tennessee National Guard today, so we're glad to have him. We appreciate his service.
If they were in Navy, we wouldn't let them do that.
Sorry, Commissioner, you just got one upped.
That's right. Fantastic.
All right, members, I don't have anyone else on the list, but would anyone else like to be recognized? Again, we're on House Bill 2143. All right, seeing none, we're going to go without, thank you all, department. Thank you all for being here. Thank you very much. So
Thank you, sir.
Thank you. So without objection, we are now going to go back in session. We're now back in session. You are recognized, Leader Lambert, for any closing comments.
Thank you, Mr. Chairman.
All right. Any further discussion? Seeing none, we are now voting on House Bill 2143, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 2143 will move to full finance. Members, anyone that'd like to be recorded as a no, please make sure to let Kara know. All right, members, that does complete our business for today. So do we have any further business coming before the committee? That completes our first calendar business. We will be back later today. So seeing none, we will stand in recess until 2 p.m. today, and we will be back here in House Hearing Room 1. So without objection, we stand in recess. That's okay. That's okay.